Have you heard about behavioral health apprenticeships? They're strengthening the behavioral health workforce in King County and across Washington state. These programs give people the chance to pursue college-credited training as behavioral health technicians, certified peer specialists, or substance use disorder professionals. This innovative pathway allows learning to be embedded in their job schedule, guided by a professional mentor, and all within the convenience of their 40-hour work week and payroll. Get connected soon to take advantage of their existing employer and apprenticeship support package. Be part of an exciting training movement that opens doors for diverse communities, supports local providers, and makes sure people have access to quality mental health care. Learn more at behavioralhealthapprenticeship.org.
Hi, everyone. This is Heather Venegas, Director of the King County Recovery Coalition, which is part of the Washington Recovery Alliance, and one of your King County Recovery Conversations podcast hosts. I'm here today to express our deep gratitude to our Recovery Day at the Mariners 2025 event sponsors. We are so grateful for your support and contributions and participation in celebrating recovery. Residence 12 Foundation, The Sober Curator, Recovery Beyond, Peer Washington, We Care Daily, AM/FM Healthcare, Evergreen Treatment Services, Hazelden Betty Ford, Fairfax Behavioral Health, Humana, Smoky Point Behavioral Health, Holman Recovery Center, American Behavioral Health Systems, Hurley Media Group, Behavioral Health Apprenticeship from the Health Career Fund, Sound, and King County Behavioral Health and Recovery Division. Thank you so much for making this annual celebration of recovery during Recovery Month possible.
Hi, everybody. My name is Christopher Archiopoli. My pronouns are he, him, his, and I am your host for this episode of King County Recovery Conversations. Special thanks to the King County Recovery Coalition, King County Behavioral Health and Recovery Division, and Orbit Audio, who's hosting us here today. On this episode, my guest is Vitor Oliveira. He and I have known each other for a couple years. We met when I was working for Peer Seattle. He was doing some recruitment for a research study, and I got to know him then. And then our paths have crossed also with the University of Washington Positive Research Community Advisory Board as well. But I will confess, I actually don't know a ton about your own personal story. I was asking around about, some great people, and our mutual acquaintance, Dr. Bender Ignacio, pointed me in your direction, and here we are chatting. So thanks for being here.
Of course, it's a pleasure to be here.
Yeah. So, just to start off, Vitor, I was hoping that you would share a little bit of your story, talking about who you are, what you do, maybe a little bit about, what we talked about and how I invited you here.
Sure. So, as you said, my name is Vitor Oliveira. Actually, I'm not an American citizen, at least not yet, but I'm from Brazil, and I have been living here for 4 years. And right now, I'm a research professor at the University of Washington, and that's became part of my trajectory and my identity as well. My degrees are in kinesiology, and actually I have a PhD in kinesiology. A lot of people don't even know that you can get a PhD on that. So I call myself an exercise scientist, and I mainly do HIV research. It's not regarding medications or treatment, but it's all about treating the comorbidities that people living with HIV experience through their lives, but try to help people with modifications in their lifestyle other than giving them more drugs for those comorbidities.
Yeah. So for those that are not great with science, what is a comorbidity?
A comorbidity is usually a condition that comes associated with the main disease, let's put it this way. So if you think about, for example, HIV or cancer, these patients, they have to deal with these conditions, but also from the medication that they take and from the action of the virus on the body, people start to experience many other diseases, many other health conditions. But because they are not the primary condition that the person lives with, we call them comorbidities. To give a practical example, for people living with HIV, a lot of these patients, they also have to deal with hypertension, for example, which is due to the medication and due to the virus itself. So before they had HIV, they didn't really have hypertension, and usually comes after that. So that's why we call this a comorbidity.
Okay. How quickly does hypertension usually develop for somebody living with HIV?
I cannot tell you. I don't really have any information on the top of my head, but one thing that I can say is that hypertension is one of the most prevalent comorbidities in people living with HIV. We just completed a study here for older people with HIV, and we had about 100 people enroll in the study, and basically all of them had at least hypertension with HIV. So it's very prevalent.
Yeah, that's interesting.
Yeah.
So why is studying HIV important to you?
Well, to me, as I mentioned, became a part of my identity with life, because I am someone living with HIV since 2008, so it has been a while.
Same, brothers.
Yeah. Okay, same here. I got diagnosed right after college, and I was 21, 22 at the time. So it has been quite a few years now. And it became important for me because at that time didn't really have much information. I didn't have much information regarding HIV, and I'm from Brazil, as I mentioned. There is a very large stigma around HIV there, still nowadays. So before, we all had that fear that, okay, I'm gonna die, I don't know how many years I'm gonna have in my life, all of those anxiety around the diagnosis. But after a few years, I just wanted to understand more about HIV. So my decision was actually to go for grad school and study people with HIV, and to understand more about this population and understand more about myself. I went to study how the virus acts in the body, medication, like all the basics of HIV from medical textbooks. That helped me to understand the population that I was about to start work with, but also understand what I should expect from HIV and what would happen with me throughout the years. And that's what I have been doing the last 13, 14 years since I started grad school in 2012.
And so did you, even before you found out that you had HIV, was science always something of interest to you?
There was always something of interest, especially regarding being professors or teachers. In my family, a lot of people, they were teachers. Also, I got a teaching degree when I was doing my undergrad, and I was a PE teacher in Brazil at that time. And then I think all the science interest came from this desire and to teach as well and give people more knowledge.
Yeah. So you talked a little bit about, the stigma of living with HIV, and, that definitely exists here, but it sounds like it's maybe a little bit different in Brazil. Can you talk about kind of your experience of understanding HIV, prior to acquiring it, growing up, I'm a couple years older than you, but, we're children of the 80s and 90s, when HIV was kind of at its height. What was that experience like growing up for you?
So before growing up and before living with HIV, in Brazil, we consume a lot of movies from the United States. And at that time, there were a lot of movies coming out regarding AIDS, regarding people dealing with wasting, and people not having access to medications, and people dying from HIV and from AIDS. So that was basically the information that we had at that time in Brazil. We didn't really have many prevention measures at that time other than condoms and the access to medication as well. People always had in Brazil, but usually we used to get older medications with more side effects. But for me personally, I grew up in a very small town of 9,000 people. So I never really knew anyone that was living with HIV. And other than these movies that I mentioned to you that always treated HIV as a terminal disease, like it was before, that was basically the only information that I had. So that's why I decided to study more and see if there was a new path for me moving forward, or if there was the only thing that I should expect for me, for example, when I received my diagnosis.
Yeah. What was that experience like for you? I mean, I remember, I was diagnosed in 2008 as well. And, I know for myself, that was a good time. There's never really a good time, but, it's better than it would have been 10 or 15 years prior, and maybe not as good as it is today. Because I remember that still being very shocking, and still being very concerned about, was I going to die? Was I, what was my life going to be like moving forward? And I know that I experienced, a pretty significant emotional upheaval from that took me years to recover from. What was that experience like for you, especially living in Brazil?
Yeah, for me it was very difficult as well because from the experiences that I had, like how I understood and was dealing with that, but also like thinking back after some years, how people who are involved with the diagnosis and the medical professionals, how it's so necessary for people to have some specific training to deal with this population. So, for example, I was living in a different city where I went for college, and then I remember going to my town for the holidays, and I was feeling very sick at that time. And then I was dealing with some wasting, some fatigue, and then I was going to some doctors. I had some type of like generalized infection that was treated as an infection, like no one suspected of any other condition. And then I got better with antibiotics. And then when I went back to the city where I was living, I started to feel sick again. And then I went to look for some medical treatment there. And that's when someone suggested that I took an HIV test. But one thing that I remember is that when I was going to get my diagnosis, basically I was sitting with someone. I don't remember if it was a nurse or any other medical profession, but basically they opened like a letter, they opened the results, and they told me that I had HIV, and that was it, and then they just let me go. So to me, I didn't really have like any shock at that moment. And one thing that I remember is that I left the clinic and then I called my family at that time. And I just told them like straight away. I didn't really think much about that. And then I was in the phone with my mom and she started to cry. And then I was away from home. So every time I was calling home, like she was very depressed and very bad with that situation. And then even some friends of mine from my city were sending me messages and asking how I was, because they didn't really know about my diagnosis, just saw the reaction of my mom and my family was having. So it is something that doesn't affect only you, but affects other people around you as well. And especially in the first years, as I said, I remember many other health professionals as well having like stigma and discrimination towards that. Usually these are the type of people that you wouldn't expect any type of discrimination, but unfortunately that was happening to me at that time. And I know that happens even nowadays. Sometimes you go like to get any other type of treatment and people ask you if you have some comorbidity. And if people say that they have HIV, they can have some discriminatory actions like towards them, which like the fact of them having HIV, if they're getting any other, sometimes they're going to get a dental work or I don't know, whatever else, and doesn't really matter. But just because the person has the initiative to tell the other medical professional because he was asked, he may face some discrimination or stigma, which is such to me, over the years, that became such a difficult thing to deal with because you never know, like, oh, should I tell? Should I not tell? Like, maybe if I don't tell, I can cause some harm for that person. But also, if I tell, I will be the one being harmed by how the person is going to treat me. So that was something that I remember happened to me a few times.
Yeah, I have absolutely experienced that as well. I think that stigmatization within, it's not just stigmatization within sort of the larger society, but that experience also occurs with medical professionals.
Yeah.
You know, in a place where you don't think it should happen, you know, where you feel like the professionals that you're interacting with should have enough knowledge to know what the risks are and what's realistic. But yeah, I think listening to what you just said, I've absolutely had the very similar experiences where, you know, you go into the emergency room and for one thing, but you end up spending 20 minutes talking about HIV, even though it has nothing to do with why you're there.
Yeah, just have a headache, and then you become getting like a kind of a therapy for your diagnosis.
And now I'm trying to explain HIV to, you know, an emergency room physician, and it just, you know, increases the trauma and makes it worse. Can you think of any like specific situations that you would want to share about, you know, where you've had a bad interaction with a medical provider?
Well, I remember my diagnosis. I think it's something that should definitely have been done differently. I remember later on for some another thing that I need to go with a cardiologist just to get an assessment of cardiovascular risk. I don't remember exactly why that was for. And then I remember that I mentioned to that professional, and his reaction was very like not so pleasant. And then I had to lecture him about HIV. That was not a fun experience. But one thing that I remember is that I discussed this with some other providers that I had more they were more open to discuss this kind of stuff, and with my infectious disease doctor as well. And to me, was an understanding that sometimes you don't really need to tell people. You know, it's your diagnosis, and you are going to deal with the consequences, or like either emotional consequences or whatever type of consequences if you tell. And especially nowadays, like in Brazil, usually I remember there were a lot of discussion because together with living with HIV, I'm also a gay person, so there are many different stigmas and many discriminations to deal with at the same time. But especially regarding gay community in Brazil, I remember a lot of discussions of people. If you have HIV, you have to tell some other person because it's an ethical issue. But the thing is, with research and all the advancements that I have today, as you know, if someone is taking the medication, they become undetectable and they cannot transmit HIV for some other person. So these conversations regarding, you should tell because you have the potential to transmit HIV to someone else. But if you are being followed up by your medical team, and if you're on treatment, and if you're undetectable, like telling someone if you have or not HIV is just much more of a personal decision for you, because you're not really exposing any of those people to any risk.
Yeah, and I think I think you described what U equals U means pretty well. U equals U is undetectable equals untransmittable. But I think there's still, I think within the gay community, that education has made its way into the general population. I think that's still not necessarily part of the broader community's understanding of HIV. I feel like I still have to explain what U equals U means to somebody who's not gay regularly, probably. But it is, if you take your pill, your medication as prescribed, that's going to get your viral load, to an undetectable level, which also makes it untransmittable, which is amazing. That even in 2008, that wasn't something that we were talking about, and certainly not something that we were talking about when we were kids. So you talked a little bit about, sort of the trauma and, what you dealt with finding out that you had HIV. How did you move past that? How did you build community and get yourself to a point where you kind of recovered from that trauma?
Yeah, I believe for me it was mainly through education and finding opportunities to work that matter on myself as well. So, for example, I remember in 2008 I had a desire to live abroad, I always love to travel, to get to know new cultures. And I had a plan to like live in some country, some English speaking country, like some years after college, to get a better chance to improve my English. But I would just remember that when I got the diagnosis, like the thing that I had in my head was like, okay, I'm gonna die in a few years, so let's do whatever I wanna do like as soon as possible. And then I just moved to another country like in a month, that happened in a decision that happened in a month. So I made a decision September 1st, September 30th, I was crossing the world and going to a new country. Wow. And I think that's where my process kind of started to deal with this situation, because at that time I moved to New Zealand, which was very, very far. There was a 16-hour flight from Brazil to there. But what happened to me was New Zealand as a society was much more welcoming with gay people and people with different sexual orientation. So everyone that I was meeting there was knowing me as a gay person. So I never really had to deal much with this issue. So I think that's where my personal growth and my recovery happened. Like just to understand that it's okay to be who you are, and that there are other ways to deal with the condition that you are living with. That's when I started to learn about HIV. That I learned that I probably wouldn't die so easily like I expected. Didn't really have a set date to die, and probably would live longer than people like in the 80s were living. People who I used to see on the movies that I mentioned to you about AIDS were living. After that, I went back to Brazil, and that's when I decided to do grad school. So I think after studying and understanding more about the condition, and then when I started to do research on myself, on my own, and like recruiting participants for some research studies that I was working on, and started to hear personal stories and started to deal with people that were living with HIV for many, many years. I remember at that time, we had some patients in Brazil with like 20 years of infection, and they were still thriving and surviving. I think all of this helped me with my recovery path.
Yeah, I think it's interesting to hear you talk about that, because I think like even though the experience of living with HIV, a lot of times when people say recovery, they think about substance use, they think about mental health conditions. But when we were talking before, I was explaining to you that I really view HIV and a lot of other things as falling under that sort of recovery umbrella too. And I think what you did is really highlight why I feel that way, which is, you talked about community and you talked about acceptance, and healing happens in community, recovery happens in community. And I think when we surround ourselves with people that understand and accept us, that's how recovery happens. It's not about trying to change something, because living with HIV is not something that we get to change. There's no cure. And the same is sort of true of substance use too. If somebody has a history of substance use, that will always been a part of their past and will always be part of their identity. So yeah, I think thank you for
of course
putting that all together. I think it was,
and I think recovery is a lifelong thing as well. Like as you said, we are living with HIV. I don't really expect to see a cure available in large scale up to when we pass away. Let's see if that is gonna happen. But think about substance as well. Sometimes the person is not really using any substance right now, but the substances are available in the world. So I think it's not a point that, okay, I'm recovered now and that's it. So I think it's a daily process that we are thinking about this, learning how to deal with the situation, still dealing with traumas from the past that sometimes they may guide some of our actions without we know why we do some things that we do. And I think it's just a process, not like a thing that happened one day and then you say, I'm recovered now. And
yeah, I think that's another really good point. Recovery is not linear, and we have good days and we have bad days, and I think that same experience happens with HIV too, because even though we may have that under control medically, the stigma that you talked about, even though you may fully accept yourself, you'll meet that one person that doesn't accept you.
Yeah.
Do you still run into that sometimes where, maybe somebody has questions? I know you also touched on the idea of disclosure to sexual partners. So I know that rejection can happen in dating and sexual partners as well.
Well, it is, yes, nowadays you still see some situations where you are dealing with stigma discrimination. I still have that. I had that a lot in my past. And I think it's something, that's what I said as well, why recovery is a daily thing, and it's going to follow you through your life, and they may guide some of your actions nowadays, even without you knowing it. But a lot of times we do some actions as a way to protect ourselves from traumas from the past. So in my situation, for example, a lot of times where I was trying to start a relationship, that became a barrier when I was telling the other person, especially in Brazil, because of all the stigma that still has there. So I remember running into many situations, and even nowadays, like, I think the gay community, even though here in Seattle, people are much more open and acceptable, but still there are some stigma regarding people with HIV, people dealing with, that had AIDS in the past, like just in. But I think it's much more like microaggressions. It's from some joke or some way that someone talks about that. But for me, for example, because I used to deal with all this trauma, sometimes it would be a microaggression for someone, become a macroaggression for you. Yep. So in my situation, for example, I would say that I have a few people that I am comfortable talking about this, especially because some other people that sometimes I was thinking about talking about this or being more open. Like a lot of times they came with type of jokes that you never know how they're going to react when you talk about these things. So even nowadays, yes, maybe in microaggressions, but I think we still deal with this type of stigma and discrimination.
Yeah, and it never really stops hurting. No matter how comfortable I am with myself, that little microaggression, like you said, can turn into a macroaggression and can feel like a big punch to the gut. Because usually it's unexpected also. I'm not usually prepared for that aggression.
Sometimes you are just hanging out or watching a movie or whatever, and then suddenly you get a punch. Like out of nowhere, someone makes a joke that may be so normal and familiar for them, but for you that are so hurt from living with this for so many years, becomes something that sometimes you just like freeze up, and you're like, okay, I don't want to lecture them here again right now,
Yeah, and it's a balance that a lot of people in marginalized communities have to decide is, how important is this to me? Do I just take the hit and be quiet about it, or do I stand up and try to educate? And, that process of education can be exhausting.
Yeah.
And so sometimes we just take it on the chin and add that to the bucket of trauma. And I think I want to thank you too you said you're particular about who you tell. So I do want to take a moment and just acknowledge that. Thank you for sharing with me and also coming on the show to talk about it, because it requires a level of vulnerability to disclose, and medical information is always your choice to disclose. So thank you.
Absolutely, yeah. For me, I think, as I said, like education was a path for my recovery, and I think that everyone could benefit so much from education. And in my situation, that I have been studying all the basics of HIV through comorbidities and treatment for so many years, a lot of times I feel eager to be sharing all this knowledge, because there are not many people doing that. And I think it's one of the main problems nowadays because, especially in Brazil, a lot of commercials, for example, say that is someone like some actor. I don't know if that person is living with HIV or not, but trying to sell the idea that nowadays you can live with HIV like a normal person. I don't really like that term at all. I don't know you, but for us that have to deal with situations not normal at all. I think the only thing that is normal nowadays may be the life expectancy, that you can maybe expect to live the same amount of years that someone without HIV lives. But it's not a normal life at all by dealing with daily medications, or nowadays they can be more spaced out, but you still need to take your medications on a regular basis. And also dealing with comorbidities and dealing with all of these traumas from the past. So, and because as people sell this idea of living with HIV is normal, we see an increase in the incident rates of HIV as well, especially among younger people that didn't have to deal or to watch the movies that I mentioned to you, so they have no fear about HIV nowadays anymore. They say, okay, if I get HIV, I can just take some medications and I'm gonna be like a normal person. So,
yeah, and I yes, I do not enjoy that word because there is this implication that if A is normal, then B is abnormal.
Yeah,
and like I want to be special, but I don't necessarily want to be abnormal. It's okay to be unique, but abnormal has this sort of like negative connotation. So yeah, I'm with you on that, and I think that is interesting. Like that, the younger generation doesn't have the same fear of HIV, and it is true that medication is great now, and if you're on an oral medication, it's usually one pill once a day. Now we have long acting injectables where people can go every 2, 3, 6 months to get that injection. So I mean, yes, there's these amazing advances. So that kind of brings me to what I want to, another thing that I would love to talk to you about, which is the importance of research. You are a researcher. You've chosen to devote your life to education and to learning. So tell me a little bit, one, about the research that you're doing, but two, about the importance of research in your mind.
Absolutely. It's a subject that I love to talk about. But especially regarding my research, I'm what I call an exercise scientist. So that may be a different type of science that people are used to. So I don't sit behind a microscope or behind a bench to deal with samples. But we basically try to get people more active and try to incorporate more physical activity into people's lives, especially because exercise and physical activity has been the most important non-pharmacological approach to improve health. So if you think about every comorbidity that either people with HIV or people without HIV have to deal with, if you think about hypertension, diabetes, osteoporosis, heart disease, basically exercise and physical activity can improve all of that. So because people living with HIV already take medicines for the HIV, we don't want them to be taking medicines for all of these other conditions as well. So that's where I see the importance of my research. And that was also acknowledged by the National Institutes on Health. So comorbidities in HIV is one of their priorities to be treated. And now that people are living longer, it becomes even more and more important for health aging, to avoid people to become frail, like when they are younger than they should be frail. So this is basically the type of the research that we do. So we have studies where we see how many physical activity people do in their daily lives and see how that associates with symptoms and comorbidities that they have. But we also have exercise studies where we take people to the gym, offer them some exercise training, and do some tests before and after to see how much they are going to improve in some metrics.
That's amazing.
And regarding importance of research, I think I talked about the importance of my research in general, which would be more in the prevention side. So if people are more active, that can help them to treat the condition that they have, like the hypertension or diabetes. But if people don't have those conditions yet, exercise can prevent and can delay the development of these conditions. So people can live longer without medications or without dealing with other diseases. But about research in general, as you said, that's, I think, the reason that you and I are here. That's the reason because we just finished a study and all of our participants, they were over 50, and there were people in their 70s and their 80s living with HIV, and they had their diagnosis study 40 years ago. So that's the importance of research, like in improving the lives of people who are with HIV, but also preventing other people to acquire HIV. And also helps with some other diseases as well. As I said, I work with people with many comorbidities, and a lot of things that we learn from HIV research that can be extended to other conditions or other diseases, including, for example, the COVID vaccine. So a lot of research from HIV could be applied to that as well and other conditions.
Yeah, because, I mean, you mentioned that you don't think that we'll see a cure in our lifetimes, but 30 years ago, do you think that people would have imagined that we'd be where we are today?
Yeah, probably not. So, yeah, hopefully that will happen. As I said, just not in something broad scale. We know there is a very particular way to cure people. There are a few people being cured, but it's definitely not something that can be applied. So let's see in the next few years how much that will be available to everyone, because we have 40 million people living with HIV out there. So it's a lot of people to treat.
Yeah, absolutely. And yeah, and like you said, the people who have been cured, that's not really easily replicated.
Yeah.
It's actually a pretty exhaustive process. But fingers crossed. Hopefully,
yes.
hopefully within our lifetimes, we will get to see that progress.
Hopefully.
So as we close up, I want to ask you just two more questions.
Okay.
One, how has your attitude towards HIV changed, from when we were kids to when you were diagnosed to today? What's that trajectory been like for you?
For me, was this understanding of what is HIV. That is not a terminal disease anymore. And everything that would I think all the stigma and discrimination usually is a lack of education. So it's something that through education, I learned that people can have an extended life. You learn how HIV is transmitted, for example, because we had so many stories of people dealing with situations where that situation happened because the other part didn't understand about HIV. For example, to not want to hug someone, or not want to share a toilet with someone, or not want to share or hold hands with someone just because of fear of living with HIV. So I think all this education helped me a lot through my life. And just to be more acceptable of other people that are different than you, that may be living with some condition that sometimes affects them very intensely, but they don't really share their thoughts. And I think just to be more understanding of people, dramas in life, and different things that they have been dealing with.
What's the one thing that you think is, what's the largest misconception that you think the general public has about HIV that you wish you could correct?
I believe the main thing is regarding HIV transmission. So basically, you are only gonna be infected by someone if you engage in a sexual activity with that person, unprotected, and if that person is not on treatment, or if you share some needles with that person. Other than this, there is no other way to transmit HIV. Yeah. I think it's one of the main things that a lot of people still don't understand. So as I mentioned, from my experience in Brazil, a lot of people, they get afraid of being in the same environment of someone with HIV just they think they have a risk to acquire HIV from that. And if I can add something else, I would say that HIV is not the worst thing in this world to be living with. There are so many other conditions and many other diseases out there that people treat as a normal disease, but they're so more deadly than HIV nowadays. And it's hard to understand why HIV has so much stigma around it, and these other conditions such as cancer or diabetes are treated so normally in the society. And I think there are things much worse to live with than HIV. So I would say these two misconceptions, HIV transmission and like that HIV actually is not the worst thing in the world.
Yeah, I agree. And that could be a whole other episode, is talking about the why of that. I imagine we both have some theories on, on why that would be. All right. Well, is there anything that we didn't touch on that you would like to leave as a parting gift for everybody who's listening and watching?
Well, just following up on your last question and your last comment as well, one thing to add is that HIV is not a disease of gay people or the LGBTQIA+ community, even though there are some specific groups that are more affected by HIV, but there are a lot of straight people dealing with HIV, a lot of straight couples as well. Especially in our studies that I did both in Brazil and here, the majority of our participants, they were not gay people. They were straight people living with HIV for many conditions. And I think all this stigma prevents them from sharing their stories and to show people that other groups as well are affected by this. It's not only a specific community. So the fight against HIV and the interest in keep the research funding coming and to keep working in this area happening is for everyone, not for a specific community.
Yeah, I think that's an important message to leave with, which is, HIV doesn't discriminate.
Absolutely.
Most diseases don't discriminate. They impact all of us. And, that's the importance of investing in research, the importance of continuing to do research. So thank you for the work that you do and the work that you will continue to do. And I hope you change the world.
Yeah, I hope so as well. Thank you for being here. And I hope this can motivate people to be more active, regardless if they live with HIV or not. But physical activity is just best for everyone.
Yeah. I mean, exercise is good regardless.
Absolutely.
Well, thank you, Vitor. I appreciate you hanging out with us. And thank you, everybody who is listening and watching. Thanks, King County Recovery Coalition. Thank you, King County Behavioral Health and Recovery Division. And of course, thank you to Orbit Audio and the team here for hosting us. This is King County Recovery Conversations. Bye.
Thank you.